And the University of Florida, their reputation depends on the type of treatment they do. So when they bring in somebody to be, their head and neck cancer guy, surgeon or whatever, they look around the Southeast and they try and get the best people they can, the people with the really good reputations for having done a lot of this stuff. Plus the fact that, excuse me, all of them go in and do a separate evaluation. And then they go together into a room and they sit down and said, okay, from my aspect, this is what I feel. And the other one says, well, I hear what you're saying, but this little caveat here, may shade this one a little bit. And the guy may say, you're right, I didn't pick up on that. And then the third guy will join in, the pathologist or the radiologist will say, we feel that in this case, with where it's located, the type cells and the stage and everything else, that this would be the best thing. Because, and I just don't know. But a second opinion it's well worth it. I just kicked myself that I didn't take Mom to Gainesville to begin with. She was seen at the base. She had faith in the guys at the base.
Is that what did her in?
Yeah. Yeah, I think had we gotten her down to Gainesville to begin with, because once the guy at the base went in there and did the biopsy, that just stirred the cells up. And since they didn't get them all, they didn't even try it first. They just did the biopsy. Yes.
Bob wants to know what the exit number is at Chieftain Buffet.
Oh gosh. I don't remember. There are signs along the interstate.
Oh, there is signs?
Yeah, there are signs for Old Time Country Buffet. Yeah. But there are some billboards that'll give the exit. It's the main one, though, in Tifton. And it's off to the right. And these guys may do a ton of this stuff, but there are a lot of specialty places that only deal with head and neck cancer.
Dr. Herrera, which is right next door there almost, in the same loop by the hospital. If the chemo doesn't do it, he's the guy that cuts me open and does his thing. He's the head, throat, and nose. The guy that went in and looked at with the scope.
So they do radiation first?
Yeah, that's what he's saying, radiation first. With their suggestion, and then he'll do his thing afterward if that don't work. He's also, when I showed this night to him, he said, that's just your carotid artery. He said, because he lost so much weight, his carotid artery shrunk. I said, are you sure? Yeah. And 2 weeks later, it's getting bigger. That's when we had it biopsied.
Oh, so at first he thought that swelling was a carotid.
Yeah. He said, I can feel your heartbeat to it.
See that?
See, that makes you wonder there.
Yeah. Tell you, sit back and let me take a quick look and see. I don't mean to introduce doubt. That's not the purpose of it.
I know what you're saying.
With my mom, I'm saying, my God, I wish I had taken her to Gainesville to begin with. They are trained, they do a ton of these things, they've got a wonderful reputation. Instead of getting some local guys that may do one of these every 3 months, they probably do 2 or 3 a day. And the more of these you do, the better feel you have for what's going on. And we've got to find out what kind of, do they want some kind of screen, or do they just want some fluoride trays?
I don't know. I didn't know if you had to do anything.
Because quite often when they do radiation around the head and neck, it damages the salivary glands.
Yeah.
Even though they try to, localize the radiation, but in Mom's case, we really went through it. With the salivary glands damaged, you don't get the normal salivary flow, so you get kind of a dry mouth. And when the mouth is dry like that, the acid from the bacteria, is a lot stronger. It's not diluted. And the saliva doesn't wash some of the debris off the teeth. So it has a tendency to stick more, and the acid is stronger, and you have a tendency to get a lot of decay down around the roots of the teeth. And with the radiation, sometimes it cuts down on the blood flow to the bone in the jaws. So at some point, you can't really do a lot of extractions because it may not heal. It's what they call osteoradionecrosis. So you need to see the whole picture, ask them, what's the chance it's going to cause the dry mouth? If I have to have a tooth taken out, what about the implants and the radiation? Are the implants going to affect the bouncing? Is the radiation going to bounce off the implants since it's metal, since it's titanium? And these are a lot of questions that I don't know the answer to because I don't deal with this stuff enough.
I'll be right in, all right? Hi. How are you? I'm Peggy. I'm Stella's breakfast supplier.
Did they seem to, or did they indicate at all whether or not the implants would be a problem with radiation?
I didn't bring it up.
Okay. So I would imagine from the images, they could see the implants. Stuff between.
So when your mom radiation didn't fix it, surgery did, or
Well,
or
we
too late?
we did go that route. After I took her down to Gainesville, the surgeon down there, he said, I can assure you, I can promise you one thing, that if you don't go back in and get the rest of that tumor out, he said the radiation will not cure it. Whereas these guys were telling me that, we'll just get the rest of the other 20% with the radiation, and the guy in Gainesville said ain't no way, ain't gonna happen.
Yeah, I agree. It was this morning. So I went out to get my car and it was like,
And it's one of these things how, you want to act fairly quickly, but get as many opinions, or at least get a second opinion from some groups that have real good reputations that do a lot of this.
like the cold.
Not that really cool, you're not bad, but don't.
I'm like 7.
How do you know how do I know how much experience these guys have?
The local ones,
The Malcolm Doctors guy said this guy's best. We both studied under this other guy
When I go to bed, I
from the University of North Florida.
between 70 and
They taught this other guy real big.
well, universities, their reputation's on the line. Every university wants to have a really strong program. One of the best oral surgery programs in the country was at the University of North Carolina. And all the big names in oral surgery went to the University of North Carolina and graduated from
And this is
there.
oral surgery that comes out.
Yeah, this is head and neck, oral head and neck type cancer.
Mm-hmm.
And the guy that did mom's surgery was an ENT surgeon, a specialist, but he had a very good reputation throughout the Southeast. you know, he was probably one of the best students in one of the best programs in head and neck anatomy and surgery.